Welcome to the AFib Foundation's podcast, where we discuss everything atrial fibrillation, also known as AFib, which is the most common cardiac arrhythmia around the world. The AFib Foundation aims to improve collaboration between patients and professionals so that they can work together on new AFib solutions, as current AFib treatments are still suboptimal today. My name is Myrthe Kuipers, and today's episode is truly inspirational. Today, Professor Bianca Brundel, who is a molecular and cellular biologist, is sitting down together with her special guest, Mellanie True Hills. Mellanie is not just a heart disease survivor, she's also an author, a public speaker, and she is founder of the Americans Foundation for Women's Health and the atrial fibrillation website stopafib.org. In this episode, we'll cover how AFib impacted Mellanie's life and how she used it as a very powerful source for change. She dedicated her life to raising AFib awareness and is helping thousands of people over the entire world to manage their AFib. Also, she's closely collaborating together with researchers, and as such, she was also co-author on our Nature Reviews Disease Primers article overview of AFib. We'll also talk about how Mellanie is the driver behind September's AFib Awareness Month and how she is the founder of the patient conference Get in Rhythm, Stay in Rhythm that is hosted in Dallas annually. This conference is the perfect location for doctors and patients to come together and learn from each other. Furthermore, we'll also dive deeper into the most reported AFib triggers and the suppressors, and these insights may potentially help you in better managing your condition. We'll also talk a little bit more about what you can do when you suspect you have atrial fibrillation. If you're someone that is suffering from AFib and is looking for guidance, or whether you're someone that is trying to learn more about AFib, this episode is packed with useful information for you. If you want to learn more about AFib or about the work that the AFib Foundation does, make sure to subscribe. Also, if you have any questions or comments, go to our YouTube videos comment sections and leave your questions and comments there so that we can cover them in our future episodes. So without further ado, let's dive into the interview between Professor Bianca Brundel and Mellanie True Hills.
I'm Bianca Brundel. I'm professor at Amsterdam UMC at the Department of Physiology. I'm doing research on the molecular mechanisms driving atrial fibrillation, and I'm a co-founder of the AFib Foundation. Today we will talk about atrial fibrillation. What is atrial fibrillation? Atrial fibrillation is the most common cardiac arrhythmia in the Western world. It is characterized by an often very rapid and irregular heartbeat. Atrial fibrillation leads to discomfort for patients, and also atrial fibrillation is a serious disease because it increases the risk of fivefold for the development of stroke, and in the end patients may develop heart failure. Currently the treatments of atrial fibrillation are suboptimal. The AFib Foundation aims to engage patients in research in the hope that researchers learn more about atrial fibrillation with the aim to develop more personalized treatments. Today I have a very special guest sitting next to me. Her name is Mellanie True Hills. Welcome, Mellanie, to the Amsterdam UMC and the AFib Foundation.
Thank you.
Mellanie is a heart disease survivor, heart health expert, internationally known author and speaker, and above all, a very passionate advocate for patients with atrial fibrillation. She founded and is CEO of the American Foundation for Women's Health and the stopafib.org, a non-profit patient advocacy organization. Mellanie, you have a lived experience in atrial fibrillation. What was the impact of this heart arrhythmia on your personal life and of the life of your family members?
So, Bianca, it's a privilege to be here, and I am 17 years AFib free. But when I was first diagnosed with AFib, it took an enormous toll on myself and on my family. I was never knowing when the AFib would strike, and it would come at most inconvenient of times. And I was always concerned that I might be off by myself somewhere and have AFib and potentially even have a stroke, because we know that AFib increases your stroke risk by 500%, fivefold. And I was never stable on the blood thinner that I was on at the time. And I was constantly at risk of either having blood that was, I was below the international normalized ratio, meaning that I was at risk of a clot, or I might be above the international normalized ratio, and have a risk of bleeding. And so I was constantly on edge as to, what was going to happen next. So my family wouldn't let me go anywhere by myself. They would always go with me. If I was going to speak, if I had meetings, they would often go with me, even to the grocery store. My son would go with me to the grocery store just to make sure I was safe. And so it was very disruptive to the family. And that's very common with most AFib patients. You never know when it's going to strike. It's always at a bad time. And it disrupts not just the patient, but the family's life as well.
When you were diagnosed with atrial fibrillation, what happened after that? You mentioned that you were on the medication to prevent stroke. Right. Mm-hmm. You are now AFib free for 17 years.
Yes.
What happened in these 17 years?
So first off, when I was diagnosed, I actually was sitting in my home office pulling email, and my heart skipped some beats and it took off racing. And at the emergency room, they said I had atrial fibrillation, which I'd never heard of at the time. And they said, we'll give you medication. You need to see a cardiologist within the next week or two, and you'll be fine. Well, I wasn't fine. My AFib would, come very erratically. I would see my cardiologist and he would say, here are the things for you to do. And I felt like I was constantly going back to see him to make things work better than what they were. And so over really about 22 months, I was fighting with the blood thinner. I was never stable on it. And along came this surgical procedure called a minimally invasive surgical ablation, or mini-MACE for short. And when I heard about that, I thought, this sounds like it might be a solution for me. And so I talked to the doctor. She referred me to the surgeons. I talked to the surgeons, and it sounded like the perfect solution for me. So I went ahead and had that procedure. And so it's been 17 years since I had that procedure, and I've not had AFib since. So that has been really wonderful not to have AFib. But I knew that I had suffered so much and other people were suffering so much, and I felt that I needed to do something once I was AFib free.
That brings me to the StopAFib.org organization.
Yes.
What was exactly the motivation to create such a non-profit organization?
Right. So I knew that other people were struggling like I had, and that there were solutions. I had found my solution, but for other people it might be something else. And so I decided that somebody needs to do something, and it might as well be me. And so I started the organization to help people living with AFib, not just the patients, but the family members too, to find a solution so that people could get their lives back like I had. And so that led me to start StopAFib.org. And it had very simple, humble origins. I put up a website with information about how to treat AFib. What is AFib? Why is it a problem? How do you diagnose it? How do you treat it? And those kinds of things. And people started coming and reading it and looking for their solutions like I had. And over time, it came to grow, and not just in the U.S., but it has grown globally as well.
Yeah, can you explain how large this community is right now, and how what was the first year? When did you exactly start this organization?
Right. So first off, I started it in 2007, and at the time, I knew that AFib was the most common unknown condition and that we need to raise awareness of it. Most people didn't know of it unless they had a family member that had it. And even then, even with a family member having it, they may not know much about it. And so the first thing that I did was to decide that we needed to raise awareness through having an awareness month. And so I decided September would be a good month for raising awareness. I found out that you declare an awareness month, you celebrate it, and then you can get it registered in the official register, which I did. So I registered Atrial Fibrillation Awareness Month, and this was back in 2007. In 2008, a representative of one of the medical societies came and, called me and said, we were thinking about declaring September as AFib Awareness Month, and we see that you already did. Can we join forces? And we did. We went to the U.S. Congress and actually together got the U.S. Congress to declare September as National Atrial Fibrillation Awareness Month. And they did that by what's called unanimous consent, which means that everybody voted in favor of it in the U.S. Senate. And so that was really kind of the start of this thing growing, and it's grown internationally as well. A lot of countries also celebrate September as AFib Awareness Month, and we have lots of things that we do in the U.S. as part of that. But over the years, I wanted to be able to better educate people about their AFib. So back in 2008, I went to my first medical conference, and I realized at that point that I wanted to have a patient conference with those same faculty members talking in patient-friendly language. And so that was not a good time to start because the economy was not good in the U.S., but in 2013, the economy was much better. And so we held our first atrial fibrillation patient conference, our Get in Rhythm, Stay in Rhythm atrial fibrillation patient conference. In fact, that year, we actually did just a half day. And patients said they wanted more. So we made it the next year, a day and a half. And they said, we want more. And so the following year, we made it a 2.5-day conference, roughly 3 days. And that has been just right. And so it has been a 3-day conference since that time. And we just celebrated our 10th anniversary of this conference and even had a celebrity at the patient conference as well, a big name in the U.S., Kareem Abdul-Jabbar, in National Basketball Association Hall of Famer, who has AFib, was a celebrity guest at our conference. So the patient conference has been a really important thing for helping to educate patients. We have people in the room with us. We have people on the live stream from anywhere from 35 to 40 countries, including the Netherlands. And then the recordings are also available for watching later. We make them available for a fee that first year after the conference to help cover the cost of the audiovisual. And then after that, they become free. And so we have 9 years of patient conferences that are available for free in our video library, along with webinars and master classes and many other videos. So it's around 200 hours of amazing content for AFib patients.
And the content is still available on the stopafib.org webpage.
It is, there's actually, it's actually in what's called a learning management system. And so on the Stop AFib site, there's in the menus, there's a place for videos, and you go to that page, and it then will take you over to where you can sign up for accessing the videos for free. Mm-hmm. But we have had a lot of interest in atrial fibrillation and have raised a lot of awareness over the years. And it's been a privilege to do things like I got to follow Barry Manilow at the lectern in front of members of the U.S. Congress. as part of raising awareness for atrial fibrillation. And I was able to thank the U.S. House of Representatives, the U.S. Senate, for passing our atrial fibrillation resolution and ask the House of Representatives to also do so. For awareness raising, I've had the opportunity to be on the Dr. Phil show to talk about atrial fibrillation and what you need to know about it. So we've done a lot of raising awareness of AFib so that people who are not diagnosed but may have it can get diagnosed. And then once they're diagnosed, they can come to our site and to our patient conference, watch our videos in order to learn what they need to know to manage their AFib, or even better, to get rid of their AFib.
So going to a cardiologist is maybe not enough for the patient. StopAFib.org offers more insight in AFib.
So part of the challenge is that a lot of patients are being treated by generalists. Maybe it's a general practitioner, a family physician, an internal medicine doctor, or a geriatrician. And so those doctors have hundreds and even thousands of diseases and conditions to treat. So they may not be up to date on all the nuances of treating the condition. Some people get referred to a general cardiologist, but we call those plumbers. And so they're working with the plumbing system of the heart, and they may not be as familiar with the electrical system of the heart. So at the conference, we have those doctors who specialize in AFib, electrophysiologists, and also cardiothoracic surgeons. And so they're the ones that are able to talk in great detail about what options there are. And so many patients learn about options that they can then discuss with their doctors. After all, doctor visits can be very short, and you can't necessarily get all your questions answered. Patients could go on for 45 minutes or an hour to have an appointment, but doctor appointments aren't that long, and so they may not get all the answers they need. At the conference, they get those answers so that they can raise the questions efficiently with their doctors.
Yeah, there's a phrase in the medical literature like one size fits all. Yeah. Does this also apply to AFib patients?
Definitely not. As some of the doctors are starting to say, if you've seen one AFib patient, you've seen just one AFib patient. It used to be believed that all AFib patients were alike, the condition was the same for everybody, but that's just not true. One of the members of our faculty, Dr. Ralph Damiano, is famous for saying that AFib is a bunch of different conditions that all share the same name. And so your AFib may be different from someone else's AFib. The cause of it may be different. The risk factors may be different. The way it manifests may be different. And so it's really important that it not be treated as a one-size-fits-all condition. Mm-hmm. There are things that are unique. So, for example, for some people, exercise will put them into AFib. For others, exercise will bring them out of AFib. So it may be very, very individualized.
Mm-hmm. Thank you for bringing up this topic. You are very actively involved in various atrial fibrillation studies. Can you elaborate on your role in these studies, and can you highlight a few studies of which you are very proud to be part of?
Right. So it's been a really interesting trend over the last decade or so that researchers have been wanting to have patients involved in studies to provide insights that maybe the clinicians don't know about. And so I have been invited for years to participate in various studies, to serve on steering committees, just to have input into the studies, to help develop the protocols, to help provide a patient perspective in developing the studies. And so I've been doing that since the very early days. About a decade or so ago, maybe not quite that much, we put together a group. My organization was working with American Heart Association and a few other patient organizations and with some researchers at the University of California at San Francisco. And we decided to put together a patient-powered research summit And so we reached out to the patient community, and not just to AFib patients, but heart patients, anybody that had, cardiovascular disease. And we recruited about 75 or so patients. And then the researchers brought in researchers from other institutions as well. And we worked together over a couple of days to determine what were some of the research needs that patients had that weren't being answered by traditional research, because someone has to fund the traditional research, and maybe they have a vested interest or they don't really know what patients want. And so we, in our AFib group, we had a small group of 4 AFib patients with some researchers, and we decided that triggers were something that just weren't researched. And so patients had a need to talk about their triggers and to have it actually researched as to whether they were valid or not. And so we proposed to do a trigger study, and together we actually got it funded and initiated, and it became the iStop AFib study. So the iStop AFib study involved looking at AFib patients' triggers. So first off, after getting it funded, we put together the patient advisory board, even a patient principal investigator on the trial. And then we went off and surveyed AFib patients through our community and another AFib community to determine what our triggers were. What triggers your AFib. And then from that list of triggers, which was published, with the 4 patients as members and co-authors of that article, we then took those triggers and used a smartphone app to allow patients to be their own controls in the study. So they would put in what trigger they wanted to test, and the app would say to either to avoid that trigger or to expose themselves to that trigger, such as coffee or alcohol, or the kinds of things that are typically raised as triggers. And at the end of the study, at the end of the initial study period, you could test a second trigger, and we allowed them to have 3 test periods where they could test triggers. And from that, we determined that alcohol was a common trigger, but caffeine was not, and some of the other things were not as well. But what was so important about that is that was a patient-initiated study. We patients are the ones that raised that as a need to be studied. The researchers helped to put together the study, and we got it funded together. And then we were able to have patient continuity throughout to continue to inform the study and even to help recruit. We played a big role in helping to recruit for the study because it was basically a sightless study. You just enrolled on your phone, and you were sent a live core device to monitor yourself, and so you didn't have to go to a study site. So that was some of the early patient-initiated research that we did. We've also been involved in patient-driven research, other patient-initiated research, and even more recently in patient-funded research, because there is a need for researching things that nobody has a vested interest in researching except for us. And so we've actually, for the last 3 years, had you on our faculty at our patient conference to talk about your research and then ask patients to help fund your research. We tell them right there that 100% of the proceeds go straight to you for your research. We don't take any of that because it's important for us as a patient community to fund the research. We have to put our money where our mouth is. We say, well, somebody needs to be researching that. Well, we're the ones that can make it happen. And so we've been very involved in that kind of research. But I've also had the privilege of being part of steering committees for clinical trials. I was on the Apple Heart Study steering committee. I'm on the Heartline Study steering committee. The first was Stanford and Apple. And then the Heartline Study is Apple and Johnson & Johnson or Janssen Pharmaceuticals. And so they find a lot of value in having patients involved, not only for recruiting, but also in helping to inform the research so that it's more patient-oriented, more patient-friendly. They're not just paying lip service, they're actually involving us patients. And there have been many other studies where I've gone out and recruited patients to be part of the study steering committees and to help inform the research. So it's important that patients are part of this process of actually defining the research and informing the research. And we patients are even getting involved in patient-informed drug development to help find drugs to help in our treatment.
Excellent. You also, I noticed that you wrote an article yourself, and that is Patient Perspective.
Yes.
Digital tools give AFib patients more control.
Right.
Can you elaborate a little bit more on this study?
Absolutely. So one of the things, we've been educating patients at our patient conference about digital tools and doing webinars and all of those kinds of things since the very early days. It wasn't just starting with the Apple Heart study. We've been actually informing them since before Apple came out with their tools for AFib. And so over the years, we have continued to hear clinicians say, oh, these tools are just making patients anxious and, causing neuroticism. And we don't want patients to have these tools because all it is trouble. It's not good. It's bad. And so I've been hearing that for years and years and years. So we know better. We know that these tools give patients peace of mind. So in early 2021, we had done some Get Back to Care webinars related to the pandemic, and a couple of those had been use of digital tools by patients and then use of telemedicine by patients in order to get care during the pandemic. And we wanted to know what additional things patients wanted to know, what additional webinars we should be doing, etc. And so this was a very long survey. Normally our surveys are 10 or 11 questions. This one was a much longer survey because I wanted to hit on a lot of different areas. And surprisingly, 763 people filled out this long survey and gave us a lot of insight into their use of digital tools. We found out things like about half of patients were using watches, and about half of patients were using other tools like the AliveCor cardiomobile device. We found out that they were using multiple tools. So a patient might have an Apple Watch, have an AliveCor device, and even be using some of the apps, such as the photoplethysmography apps, where you put your finger over the camera and it uses light to detect what's going on with your heartbeat. Some of them were using medication trackers. They were using other kinds of trackers. And so we found that there was a lot in use. 73% of our patients were using digital health tools to manage their AFib. And that was a surprise even to us, because even though we had told people about these tools and done a lot of programs on them, we were a little surprised that the percentage was that high, because they're mostly seniors. So these tools, some of the value that our patients told us that they found from them was it helped them to better control their AFib and to give them the peace of mind that they needed in trying to manage their AFib. So these digital tools were extremely valuable for patients. And so one of the messages that we delivered is that we encouraged clinicians to embrace digital tools with their patients. We tell our patient community that the best thing to do is to have a conversation with your doctor as to whether these tools would be valuable to you, because for some patients they may not be, and to negotiate with their doctors what's appropriate, how many rhythm strips are okay to send, and what's, excessive, and when should I be sending a rhythm strip to you as a doctor. And so we really encourage patients to partner with their doctors in the use of these digital health tools, because they can help them manage it better, and it makes patients more proactive in their care. They often are more adherent to their medications and to their treatment plans. And some even said, it helps me know when I need to have a procedure.
So each year in August, you organize the Get in Rhythm, Stay in Rhythm patient conference for patients with atrial fibrillation in Dallas. What was your motivation to start this conference?
So I felt that patients weren't always getting a complete picture from their doctors. And maybe it's just because there's not time in short medical appointments to cover everything that patients need to know. And so I brought together that first year some of the world's top faculty, top doctors, electrophysiologists that treat atrial fibrillation. And it was really eye-opening to see how much patients gained from this conference. And so we continue to do it because we find it so valuable. And it's really interesting to find that, for example, Dr. Prostowski is a member of our board of directors, and he is at our patient conference every year. He is, all except for one, he has been at 9 of our 10 patient conferences. And he will so often be talking with patients over lunch or during the breaks and find out that they're on a medication that they shouldn't be on, because they may have asthma or COPD or some other thing where that particular medication is not appropriate. And so often it's because the patient is being treated by a generalist that may not know these things. And since Dr. Prostowski wrote the book on medications for AFib for the doctor community, he knows these kinds of things. And so he is often telling patients that they need to have a conversation, or they need to maybe see an electrophysiologist to get their treatment right, because the way they're being treated is not always the best way to be treated. So this has become a really important conference in the AFib patient community. And we have patients from all around the globe that are watching the conference on the live stream. And we even have some that come back internationally year after year to the actual conference in Dallas.
Yeah, this is clearly a win-win situation. Patients learn from the health professionals,
yes,
but the other way around as well.
Exactly.
And the health professionals definitely learn from the patients.
Absolutely. And some of the world's top doctors, I ask every year, and they always say yes. We have, some of the top names in electrophysiology that have been on our conference faculty every year. And so patients know to trust those doctors, and they come back and ask updated questions, or they may have gone and done their homework and they're asking questions of these world experts. And then they are more informed for when they go back to their doctors.
Mm-hmm. Yeah, very nice. Also, the AFIP Foundation participates in this conference.
Right.
Since 2021.
Yes.
I present at the conference.
Yes.
And also last August, we presented our research at this conference, and we asked the participants about their triggers and suppressors for atrial fibrillation.
Right.
And I want to show you the outcomes of this question, because we used a Mentimeter to get and collect all the responses from the participants. And from the word cloud, you see over here, stress is a very important, often mentioned trigger for atrial fibrillation, but also like alcohol, caffeine, lack of sleep, dehydration.
Yes.
Can you elaborate a bit on these triggers?
Yes.
And what is your opinion about it?
So dehydration, I think, is one of the most important triggers. And it could be that patients can have alcohol, can have caffeine if they're staying hydrated, because alcohol and caffeine are dehydrating. And they may be drinking those instead of staying hydrated with water. And so I think dehydration is a big issue, but certainly caffeine and alcohol as well. Stress, when I first started the organization, there was no research showing that stress had a role in AFib. And we knew as patients that it did. There's been a lot of research since that time indicating that, yes, stress is a significant trigger for AFib, and that we don't really know which is the chicken and which is the egg. Is it the stress causing the AFib? Or is the AFib causing the stress and making the AFib worse? So we really don't know, but stress is definitely a trigger for many, many people with the AFib. And then, some of the other things that are on here, exercise can be a trigger of AFib. It can also suppress AFib. We see fun things like chocolate, that is often said that it's the caffeine, but some people say it's the sugar as well. And so there could be a lot of dietary triggers. And our triggers research that we did indicate that there were a lot of dietary triggers. Some people said excess salt. Just so many things that potentially can be an issue. Sleep apnea is probably one of the most common ones that is unknown to many patients. They may say lack of sleep is what's causing their AFib, but it actually could be sleep apnea that's causing their AFib and causing their lack of sleep. We know that 50 to 70% of those who have sleep apnea also have AFib and vice versa. So there's a huge overlap there, and treating sleep apnea can help decrease the AFib burden. So there are a lot of triggers that were mentioned, and these are all really important triggers for the AFib patient community. And so we're excited that that's an area that you are interested in researching.
Yes, indeed. There's also one specific group of people who mentioned that they develop atrial fibrillation regularly at 3 o'clock in the night.
Yeah. So that's probably sleep apnea. We know that when you stop breathing during the night, your body may try to respond to that and get you to start breathing again. And so it shoves adrenaline into your system and wakes you up so that you'll start breathing again. And that is an indicator that you have sleep apnea. And so we tell the patient community that if they're waking up consistently during the night with AFib, that is a real important reason to get tested for sleep apnea.
Yes, yeah, I agree. Thank you. There's also a large group of people who say, I have no idea what triggers my AFib.
Some people don't know what their triggers are. They may try tracking things, and sometimes that will cause AFib and other times it won't. And so it's not unusual for some people just not to be able to identify what their triggers are. So I never could figure out exactly what triggered my AFib either. Sometimes it would be leaning down to wash the dog, and other times that wouldn't trigger it.
We also asked the participants about suppressors of their atrial fibrillation.
Right.
And here's the word cloud that gives an overview of the outcomes. Many patients said that medication intake or cardioversion helped to stop their atrial fibrillation.
Right.
But also patients mentioned like magnesium and exercise. Especially magnesium is an interesting suppressor of atrial fibrillation. What is your experience with magnesium intake as suppressor of AFib?
So it's commonly known in the AFib patient community that magnesium can make a huge difference. And most people that try it find that it plays a role in helping manage their AFib. Now, part of the challenge is there are a lot of different forms of magnesium. And AFib patients have, for the most part, found that there are a couple of forms that work best for us. Magnesium glycinate is one. Magnesium taurate is another. And typically, we recommend starting slowly and build up gradually, and try not to overdo it because it can have some strong effects. But between magnesium and taking that with potassium and staying hydrated, that can cure a multitude of ills and can help greatly in managing AFib. So magnesium is a really important one. Some of the others that are important are, just electrolytes. We encourage drinking mineral water. That can make a huge difference. That helps you stay hydrated and gives you the minerals that you need. So that's another one that's really important. Making sure you get enough sleep is really important, because if you're running low on sleep, you're more likely to trigger yourself into AFib because of the stress. And other exercise is one of those that I mentioned before. It can trigger AFib, but it can also stop AFib. So that's one to just kind of try and see if it makes a difference. The whole area of yoga, deep breathing, meditation, that is another thing that can sometimes help stop AFib. And then finally, a lot of patients find that laughter is a help. They'll watch cartoons or, a comedy movie or something like that, and they kind of get lost in it, and they find themselves converting sometimes.
Oh, very interesting.
Yeah.
Yeah, good suggestion.
Yep.
You are very active within the American Foundation of Women's Health and the StopAFib.org organization. What is your future outlook?
So we believe that there's a lot more to be done in the patient-initiated, patient-driven, patient-funded research area. And so we'll continue to do a lot in that space, because patients need to have a seat at the table when research is being determined. So it's important for patients to be part of that process, because we know things that clinicians and researchers may not know. And so that's an important role for us. Additionally, we have been training advocates. We've had several advocates over the years that have worked with us and have helped to speak out about AFib and to work with clinicians, to be part of research studies, and to do lots of things related to AFib. And so we recently trained our first class of advocates to take on roles in this area, because there's not enough of me to go around. And so I'm trying to train them in the kinds of things that I know so that they can step in to some of those roles. So those are some important things. Another thing that we're really focused on a lot is the whole equity space. Health equity is a huge problem. Many people are not getting diagnosed with AFib, and they're not being treated properly. They may not even have access to care, to medications, to treatments that they need. And so we're doing a lot of work in the health equity space as well to make sure that everyone with AFib has access to the treatment that they need and can make sure to get their lives back as well. I feel very fortunate that I got my life back from having a procedure 17 plus years ago. I want other people to be able to get their lives back too. And it's not just the patient, it's the family members as well, because AFib disrupts everyone's lives. Patients may want to, do something with their family, and then they're in AFib and they don't feel up to it. And so the family suffers as well as the patient. And so our goal is really to help people find their solution, and that helps the family as well. And it can be an emotional issue. It can cause a huge amount of stress for people that live with AFib. It can be exhausting. It can be physically exhausting. It can also be financially devastating. For some people, in the U.S., insurance may not cover everything, and you may not get the care that you need. And so it's important for us to help patients and clinicians understand the financial impact that AFib can take so that we can get patients access to the care they need.
So what is the message you want to give to people who get diagnosed with atrial fibrillation?
It's very often thought by doctors that you can just watch and wait. And AFib is benign, it's not going to hurt you. But nothing could be further from the truth. It can cause a stroke. It can cause heart failure. And we're starting to learn more about how it can even cause dementia. So it's important to start treating early and to make sure that you're protecting your brain, both from stroke and from potential dementia. So very often people will be left in AFib long term. So the sooner you can get it under control, the more likely it won't do damage to you. So my message is to get something done immediately. Don't wait. Don't just think it'll go away, because it probably won't. You need to get treatment. You need to get it under control right away. Do as little AFib as you can. In other words, try to stay out of AFib, because being in AFib creates damage. It creates scar tissue in the heart that can lead to strokes and other issues. It creates other kinds of issues that can affect the brain. We're early in our research of it, but we know enough to know that it can affect the brain, whether it's small strokes, which is a possibility, or whether it's bleeding because of anticoagulants. It's important to get it under control so it doesn't affect the brain. And, finally, it just doesn't feel good to live in atrial fibrillation. Life is much too short to live in AFib. It's best to get it treated, get out of AFib, and be in sinus rhythm.
Thank you, Mellanie.
Thank you.
This was the last question of the interview. I want to thank you very much for sharing your insights on atrial fibrillation with our community. And I do believe that your commitment to get more AF awareness and to get patients involved in the research will hopefully in the end help to better treatments and more individualized treatment for the patients.
Thank you. It was a privilege to join you today, Bianca.